I've been doing some research on some new ways to make treatment more effective for our patients in a physical therapy setting. And one big thing that came across is a new concept of evidence-based sex and gender medicine. This would include the fundamental differences of biology and behavior between men and women, and what should be done to improve healthcare for both of them. As we know that men and women, there's a lot of differences in terms of who's more prone to certain diseases, men with Parkinson's and heart diseases, and women with stroke and osteoporosis. We can, see that in terms of our patients. A lot of our OA patients, osteoarthritis, are women. And we do tend to see more male Parkinson's that come in for gait and balance. So the prevention, management, and therapeutic treatment of most of these common diseases does not reflect the most obvious important risk factors for the sex and gender of each patient. So a lot of this research is showing that that with the wealth of data out there, that the medical field, despite the data and differences, medical practice does not sufficiently take gender into account in diagnosis, treatment, or disease management, and this is due to lack of education and training of medical professionals. So what does that mean for our patients? So if we take into account the amount of males and females we see and treat and what we're treating them for, what changes can we make in our day-to-day in terms of questions and what are their comorbidities. So from a rehab perspective, we kind of look at what are we treating, whether it's our post-operative patient or Parkinson's, stroke, and we just generalize it. But we don't necessarily adjust our programs to the specific needs of the gender. And most commonly, we look at the limited mobility of females versus males. Once they become older, they tend to put their health on the wayside for their family, their kids mainly, and they don't necessarily have a car, but they're not able to get in and out as easily as men. So if we take into the account females are not as active, that could be contributing to why they have so many issues with osteoporosis. So what can we do for them? Can we get out into the community and make educational sessions in their communities and just give them easy exercises to do at home in order to keep them strong and active, easy stretches, easy strengthening exercises. Just get out and walk in the neighborhood and just to assure that they, keep their heart rate up and prevent hopefully any heart diseases or any other bone issues and that they could develop in the later years, or even getting into the local senior centers and getting that older crowd to just come in, teach them some newer exercises that can keep them moving longer instead of shuffling along. Most of these women end up being scared to fall. And we can help them with that, make them feel more confident just by making them move better and understanding that exercise is key. Same thing with the men. It just seems that the men tend to be more confident in themselves and want to keep it moving. But that doesn't mean that our personalized medicine is going to replace gender-based medicine. We will still do our normal treatments, just maybe we take into consideration, well, what was your lifestyle prior to coming to see us? What would you like it to be? And make it a more personalized treatment plan, and taking into consideration, okay, well, you are a female and this is what we're going to do for you, or you're a male and this is what is more likely to happen with you, and here's why we're going to help. But then there's also, with the rise of the LGBTQ community, just coming out there, being a strong advocate for anyone who's transgender, we need to take that into account as well. it helps us with treatment, if they're, coming. One patient in particular I had transitioning from female to male, and we had to take into consideration, well, you're at an age where you would be going through puberty, but you're also changing your hormones. So how is this affecting your body? So that's something to keep in mind with, what can we do to make sure you don't hurt yourself and strengthen your body in a way? Because we know that certain things in your body change, things get lax because of the hormone changes, and your body doesn't really know what to do. So how can we safely strengthen you up and in a way that'll promote your health as you're going through this transition? And certain ways that we can do this moving forward in all aspects is, can we change our intake forms to sit, just ask certain questions in a way that won't offend anybody, but can just help with our treatment, such as, how, do we do it through a form, or do we have a discussion with the patient during the evaluation? But it can be easy questions added into the notes, asking, like, how do you think of yourself in terms of sexual orientation, or do you think of yourself as male, female? And that way can just give us an understanding. And it's up to them to divulge that personal information. And if they don't want to, that doesn't necessarily change our whole treatment plan. That doesn't mean we can't help them, but it could help in terms of making recommendations for either referrals to specialists, or exercises or certain supplements, if we have a better understanding. Also, in terms of who they might want to see, if they want to be treated by a male or female, it can just give us some extra information. Of course, if it is a minor, it is up to the parent to divulge that information. And generally, in my experience, I've seen it more that it's just so, as the provider, we know how to address the patient, and only the providers know. We don't need to let anyone else know any of that information. That's their personal information and up to them. But having that knowledge can help in our treatment plan, and hopefully make a more patient-focused treatment. So if you have any questions, please feel free to reach out to me, and I'll see you guys at the next video in service.